Hello, and thank you for joining Anthropology News Talk. Today we'll talk about a couple topics that will lead us to a discussion on COVID-19, from doubts to the very roots of the problems that are going on and that have been highlighted due to the ongoing pandemic. We're going to start off by talking about social determinants of health, specifically on social and community context, education, and economic stability. Starting off with social and community context, people's relationships and and interactions with family, friends, co-workers, and community members can have a major impact on their health and well-being. Now, in relation to community context, this can mean what is in the community for the group of people living there. Sadly, in some cases, there are food deserts. There is no access to healthy food, and only fast food are available, affecting their health in a negative way. Now, moving on to education. I'm going to pull up an article on this social determinant published by the CDC, where they state how disparities in education can affect an individual. Health disparities are also related to inequities in education. Dropping out of school is associated with multiple social and health problems. Overall, individuals with less education are more likely to experience a number of health risks such as obesity, substance abuse, and intentional and unintentional injury, compared with individuals with more education. Higher levels of education are associated with a longer life and an increased likelihood of obtaining or understanding basic health information and services needed to make appropriate health decisions, showing that without education, one's health is at risk as well from the very beginning, which can lead to other factors such as economic stability. Now, in economic stability, this relates on how people are doing financially. Now, in relation to low-income neighborhoods, there is more struggle with health care, if in need of health care, because of payments. Either they can't do it by themselves or are financially unstable to do so. They could also struggle with getting medicine and other medical needs. Personally, I see this as well from the community I grew up in and still currently live in the west side of Chicago, where one has the choice of feeding the children or paying for health care. And it's a sad reality. Now, these social determinants have affected people's health, and those people who are being negatively affected have been those living in low-income neighborhoods, African Americans, and Hispanic people as well. Leading me into the next topic of COVID-19 in science and society. I'm going to pull up an article real quick from The Atlantic, and they have stated that there isn't much confidence in the scientific field by Black Americans. And quote, many Black Americans too are understandably suspicious of the vaccines and the broader medical establishment. After regularly receiving discriminatory care, hearing about the Tuskegee syphilis experiment, and seeing family members die of COVID-19, the healthcare system has not proven itself trustworthy, said Jasmine Marcelin, an infectious disease specialist at the University of Nebraska Medical Center. This is a distrust that has been going on and hasn't been repaired. Not only this, but people in political parties have also had their own thoughts on how COVID should be handled. However, there's also a matter of wanting to end the pandemic. Doesn't matter which political party one is in, there's an agreement that Americans do want COVID gone. In the same article by The Atlantic, it has stated that most Americans across the political spectrum support measures aimed at curbing COVID-19, including restricting restaurants to carry out, canceling major sporting and entertainment events, asking people to stay at home and avoid gatherings. According to surveys done by Laser, the Northeastern political scientist, and his colleagues, some state leaders have thus far been unwilling to enact such measures, but their attitudes might shift when the Biden administration takes office. Quote, I've talked to many governors who, regardless of geography or political party, want to know what they can do to limit the transmission of this virus, said Osterholm, who is on Biden's COVID-19 task force. COVID is coming to a near end due to there being widely vaccine distribution, but with mistrust and misinformation, this can very well delay of this becoming a quick reality that many of us really want, I myself included. Which finally leads me to the FDA, specifically the creation of FDA regulation. Now, when it comes to the vaccines, there are many doubts and conspiracies, from how fast the trials were conducted to the misinformation that could be found on the internet and social media. They're constantly being talked about by leaders and people in power. This is why the FDA was created, to ensure that the vaccines that are being distributed are up to par and will be helpful. The FDA was created just for moments like this, to make sure that this can be used on humans and is effective at what it does. During 1938, the FDA was already making sure that this was put to place. They had drug manufacturers having them required to provide scientific proof that new products could be safely used before putting them on the market. An article published by the Mayo Clinic has stated that the FDA will review the results of these trials before approving COVID-19 vaccines for use. But because there isn't an urgent need for COVID-19 vaccines and the FDA's vaccine approval process can take months to years, the FDA will first be giving emergency use authorization to COVID-19 vaccines based on less data that is normally required. The data must show that the vaccines are safe and effective before the FDA can give emergency use authorization. There's been many conspiracies and misinformation online that can be found on a click of a button, but the information that the CDC and FDA have on current vaccines are deemed safe and have shown to be effective against COVID-19. Now, to those who are listening to this podcast and still have questions or concerns, I will also have the link to the CDC page, those who have frequently asked questions about the vaccine, such as, can I get COVID-19 vaccine and can it still make me sick with COVID-19? If you have questions amongst that one, you can click on the link below and be informed more about the vaccine and any other concerns you may have. Now, that was it for tonight. It's Anthropology News Talk. Thank you for tuning in.